Anterior.
Anterior, right? So this side. All right, let's talk about the kidneys. As you know, we've got two. The right kidney sits slightly lower than the left kidney. Anyone brave enough to tell me why? The liver. You got it. The liver's going to push it down, right? And when you take in that big deep breath and the lungs fill up, it pushes the liver down even further. So what is it going to do to that kidney? It's going to push it down even further. Okay? So it sits posterior and inferior to the right lobe of the liver. And you guys, have you talked about Morrison's pouch in your other class? All right, perfect. Morrison's pouch is going to be between that right kidney and that liver, the right liver. And so, if you see fluid in there, is that a good or a bad thing? Bad. It should be liver and then kidney. So you're always looking. What in ultrasound, what we're looking for is basically the parenchyma, right? We want to compare the parenchyma, which is tissue. For those of you who don't know that, understand that term. Parenchyma, tissue. We're trying to compare the tissue of the liver to the tissue of the kidney. Okay? And how do we know if they have a fatty liver? Because I know you guys know this one. Yeah, it's going to be more echogenic. It's going to be very, very bright, right? And that is fat. And so a lot of times that's how we can tell if they've got a fatty liver, is comparing it to that kidney. So that's the right side, sits a little bit lower. I've got a star on this page too, because obviously you're going to need to know that. Left kidney is posterior to the spleen and the stomach. You guys know that because we talked about that last week. All right? So I do have an asterisk at the bottom here. The psoas and the quadratus lumborum. Did I say that right, Shay? Who knows?
Sure, yeah, I'm not sorry.
Yeah, it's a fun muscle that you're going to learn later. But these muscles are posterior to both of these kidneys, and you're going to need to know that for your future class. You're going to need to know that on your boards. So again, we're going to start on this page, and I will show you what that looks like right here. So as you guys can see, this right here, more medial, is going to be the psoas muscles. You can see how they just run right up by the inferior pole here. You can see that. And then a little more lateral is going to be your quadratus lumborum muscles. And that's right here. So if I were taking notes, I would probably put this one's lateral, this one is more medial. You will see these sometimes when you are scanning kidneys. You may get an ultrasound image on your boards, and they may ask you what muscle it is.
Do we need to know what they do?
Not really. Yeah, isn't that great? Just need to know that it's there. Alright, any question about that? Alright, let's talk about the anatomy of the renal really quick. You guys have not had this yet in Rain's class, right? Okay. You're going to learn most of this stuff in Rain's class, but I just wanted to put it in here so that you guys could understand when we're slicing the kidney, you know what everything is. Okay? And for Rain's class, you'll kind of know most of what you need to know. That'll be good. Let's start. So we're going to go outside to inside. Alright? So on the outside, you've got that renal fascia, aka Gretta's fascia. You'll need to know, we use those terms, both of them. As you've noticed, there are like 3 terms for everything. No. So that just surrounds the fat, the adrenal glands, and that capsule here. So what you do need to know, because there could be a trick question, that it only covers the kidney, but the renal fascia actually covers the adrenal gland and the kidney. Okay? That is why there is a star on this page as well. So don't let somebody trick you with that question. This is going to surround both the kidney and the adrenal gland. Then you've got some fat. tissue, just surrounds that kidney. I have, however, seen some of the fat because it was very pronounced. And so if you see something that looks like echogenic material, we kind of know that that's just going to be fat, not a big deal, right? And then you've got the true capsule. So the true capsule is a fibrous membrane surrounding just the kidneys. So if I wanted to be tricky, I would say the true true false. The true capsule covers the adrenal glands and the kidneys. Is that true or false? False. Exactly. It is actually the renal fascia or Verada's fascia that does it.
Can
Okay.
you again point at the three of them, at those capsules again?
Do what? Yeah. So the renal fascia is going to be out here. You can kind of see it right here. That's what it looks like. It's gonna go around all that fat, the adrenal gland, and that kidney. Okay. Then you've just got that fat. So remember, we're going outside in. And then you've got the true capsule. And the true capsule, for me, I remembered it because it says true capsule. So to me, I was like, oh, that's the true capsule. I mean, it's truly going around that kidney only, right? So if you need to think about it in a logical way, right? Yeah. Any questions?
Oh,
Capsule, their like membrane that you see on the bottom?
It's
Or-
right here. It's not showing it very well in this picture, but it's covering the kidney.
No, Bree, I think the one you're talking about is the bottom one, yeah?
This one's on the outside.
Yeah.
This is the renal fascia. Yeah, this is all renal fascia here, and you can see it here, right? Because it's outside of the fat, it's also outside of the adrenal gland, and outside of that.
on
Okay.
ultrasound, which capsule we see, or we see all of them like one capsule?
In ultrasound, you probably won't even see, you're not gonna actually see probably the renal fascia. You're not gonna actually see the adult patients. Yeah.
True capsule would be.
And the true capsule, possibly, but it's just gonna be like an outline.
I would say the only time it's really appreciable, remember we talked about hemorrhage, hematomas?
There
So if
go.
you have like a big hemorrhage between the capsule and the kidney, then you're like, oh, there's the capsule. But otherwise it just blends
Yeah, I was
in.
gonna say, otherwise you don't really see it, right?
Thank you.
Awesome, the shades here.
Oh, yeah.
Love it. So now we're going further in, all right? So we've got two different kind of like capsules, right? And fat in between. And then now we're dissecting and we're cutting that kidney right in half. Oh, I love these. These are so much fun. And they light up like a Christmas tree when you put color most of the time. So, especially on your bodies. Not so much on the real ones in the world. But these, I just love it. It's beautiful, you can see everything. It's gorgeous. So on the outside here, see here's that capsule, Tanya, right here. We don't really see it. And so just to emphasize what Shay said, if there is like a hematoma or some kind of something going on, then we would see it. But other than that, we don't. Cortex is going to be the outside, just like that adrenal gland, this part right here. See? And then the medulla is this section. And it only goes from the base to the apex of these pyramids. So here's your base, here's the apex, just like a heart. So cortex, medulla. So cortex is the lateral portion of the kidney. The medulla actually is the more medial portion, and it contains all those pyramids. It's cone-shaped, projections within the medulla, the apex, which we talked about right here, towards that renal sinus. This is going to be the renal sinus. This is where fluid drains. The base is towards the cortex, what things would we want to look and watch out for in the kidney? Anybody?
Fluid?
Fluid? Yeah, what else?
Vascularity.
Obstruction, stones, cysts,
Hemorrhage?
hemorrhage, right? Yeah. So we're not worried about counting how many of these pyramids that they have. We're looking at the structure. We'll talk about that in a few seconds. Feels weird not having my clicky thing, so I can't really walk around today. Okay, so that renal sinus, let's talk about this section right in here. So the renal sinus, central area of the kidney includes the calyces, the pelvis, and the hilum. The hilum, are you guys getting used to the hilum? Yeah, that's where everything enters and exits, right? We've got that in the spleen, we've got that in the liver, and now we have that with our kidneys. What do you think's in the hilum of the kidneys?
Vessels.
Vessels.
Lymphatic nodes.
Yes. That. What else? Yep, we got the vessels. What did you say? Yep, arteries, veins, and a very important thing. Ureter. You got it. You got it. So the minor calyces, and I'll show you on the next picture. It kind of divides the major calyces, and the major calyces divides the ureter. Okay, and so we've got things filtering in there, and then the renal pelvis. That's proximal extended portion of the ureter where urine is collected from the major calyces, and then the hilum, like we talked about. That's the most medial area of the kidney where the ureter, blood, and lymph vessels enter and exit the kidney. Look at that, I had the answer up here for you guys. So let's talk about it. This is the best image I could find for you guys, a little cross-sectional here. So we've got the cortex. Well, let's start with the outer portion. What is this capsule called? True capsule, right? Because it's truly going around that kidney. And then we've got that cortex, the medulla, and the medulla has a bunch of pyramids in it. And then you're going in, entering into that renal sinus. The renal sinus has, here you go, the minor calyces. So they're really small, they kind of just go in between. And then the major right here, as you can see, and fluid just being dumped right into that center here, into the renal pelvis. And then it goes out that here. Okay. Any questions?
No.
Just the basics so you guys know, because we're going to talk about it. We're going to take a look at some ultrasound images. Here's a few more images for you guys. If you're struggling, this is all together, everything. Does anyone remember if the vein or the renal vein or the renal artery is posterior?
Arteries.
Artery. Remember I think we talked about this in our very first lesson, right? So you guys already know that. So you know that that renal artery is going to always be posterior to the renal vein. That'll show up on the question, that's for sure. All right, so we've got our vessels here. Got some nerves, like that. All right. Little activity time. What I'm going to do is have you guys draw, label, and color code each section of the kidney. And a lot of you guys have it on your computer, so you won't have to draw it out. But or you can just color code this if you've got it printed. But I want you to color the cortex green, the medulla purple, the renal sinus and the ureter yellow, the renal vein blue, and the renal artery red. And then I want you to answer this question. Where are the pyramids located?
Middle.
I feel like I should play picture, I can look at it, but that close. So this picture, that just shows you the true capsule. How it's the true capsule and label that. Go ahead and do that.
Green cortex. Captures two pixels. Green. Where do I have green? Green. So let's see this down. Cortex. And green. You do the purple.
Yeah, just make sure you guys always bring your colored pencils, crayons, or markers to class, especially this one, just in case.
Purple. Renal sinuses. Yellow.
Hey, thanks. Well, I just want to get it done before they have their. Are you coming at 5?
What?
You gonna be on at 5?
I just there's a minute there. Usually I stick around for a while.
No.
Do-do.
Well, the other
Have my
Ah, you're doing great. New technologies. Blue for me. Arteries. Ureter even more posterior than artery. Is it true?
Artery is more posterior.
Than about uterus.
Oh, the uter. Just in this image, you can kind of see how it's going down.
Mhm.
Yeah. So you just color that.
Uh-huh.
I almost.
putting on the same stuff you're saying today, you learned yesterday. Reinforcing concept.
Yes. Oh, this is awesome.
Some PDF program you do it.
No, it's actually just what she posted. I downloaded,
Uh-huh.
and then this is how it comes out. I didn't select anything.
Oh, you can do it in your...
Yeah,
Because that's showing here.
it came out as a PDF, and they
Yeah,
have
the
all these
cortex in
tools.
this image particularly, guys, is a little bit smaller than it normally is. Only because this image kind of shows that true capsule.
It doesn't divide into cortex and
I mean, as long as you know what you did, this would be the true capsule right here, this outside. And this would be cortex right here. And then anything between here and here, here and here, is gonna be your medulla. Yeah. Remember, we talked about this because I saw this on a couple people. This posterior vessel is gonna be an artery. So the color of that one should be red. And the anterior is the vein. And where are the pyramids located?
Medulla.
Medulla. Got it. Yeah, this is the sinus. You can see the sinus. This is part of the sinus right here. This right here is part of the sinus. And then this whole section right here is the sinus. And then it's drained down. Raise your hand if you have any questions or you want me to look over your stuff.
Is it special document on iPad or you just download the lecture PDF and just play?
No, it's an app.
Oh. Oh, yeah, I see. Thank you.
You know, even on the apple, that would still be. Right.
Pyramids are here. Sorry again.
It's okay.
Pyramids, 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 pyramids.
All right, you guys, I'm gonna have, Coy's gonna walk around and show you hers because it's perfect.
Ooh.
Yes, so I'm having to show everybody. Yes. Yeah. Oh, she wants me to help, okay. This is beautiful, what it should look like. And she just chose not to color her pyramids. She could have though, so if your pyramids are colored purple, that's fine. That looks great. Alright, so you can check yours. Bring your pencils in here.
Do we count pyramids as part of cortex or medulla?
No, medulla. The pyramids are part of the medulla.
It's located in medulla and it's part of
Yes,
medulla.
yes.
Okay, got it. Thank you.
You're welcome. Asia, yours looks fantastic. I am looking at a lot of yours and they just look fantastic. You guys are doing such a great job. Now it's important to have this color coded because you're gonna flip back to it constantly because we're gonna look at some ultrasound images and you're gonna want to know what each section is. So this will help. Do you guys need any more time? Ready to move on?
Ready to move on.
Let's talk about the sonographic appearance then. This is where your probe, as you guys know, probe's gonna be here. Those of you who are having a hard time in Amasha for the longest time, you're like, I can't figure this 3D thing out, right? And that's quite okay because it takes a while, and I feel like you guys are starting to pick up on it now and understand it. But it's okay if you're not quite there yet, right? And so this picture is just hopefully giving you guys just kind of a little chop so you can see what your probe is doing and all of that stuff. So this is going to be your kidney. And this is what it's going to look like when it is on the screen. Okay?
Real quick, here's all your pretty homework up front.
Woo!
Thank you,
Oh,
Shay.
so fast. Thank you.
I know.
Okay, sounds good.
I was telling them, like, I know if you did good or not. All right, so kidney sonographic appearance. Oh, look at what we have again. Our little gas sign. So this is gas. Just to remind you guys, right? I probably ruined that. and everything. I put the little gas sign for them, and it will forever haunt them. But This way they won't say, oh my God, you have a mass in your stomach.
All the best on your wedding, Shay.
Yes, oh yes.
Oh.
I love you all.
Congratulations.
See you on Monday. I'll leave any questions. Don't get the wedding. All right, let's get it.
Bye.
Bye, have fun. So this is gas, I just wanna make sure you guys knew that. And then we've got, here's our liver, right? And what is this section right here? Morrison's pouch. Got Morrison's pouch. And then you see how you don't really see a capsule or anything? And you're not really gonna see fat, you're not gonna see an adrenal gland. But this is the upper pole, so this is your superior. Your lower pole, which is your inferior. When it comes to kidneys and it comes to radiologists and your worksheets, you sometimes are not going to necessarily say superior. It wouldn't be wrong, but they like you to use the term upper pole or lower pole. So breathe, more terminology for you, right? But you're not wrong if you say superior or say inferior. Yes. Only referencing to kidneys. Some rads just like it, and some of the worksheets will say upper pole or lower pole. And so I just put this in here so that you guys would understand what they mean. Because sometimes they're going to use that.
So it's upper pole superior.
Yep, upper pole, superior, lower pole, inferior. You got it.
You're saying you only use it in relation to the liver? Is that what you're saying?
Yeah, because if there's like a cyst or a stone or whatever, right, you're gonna have to say where in the kidney it is. We're gonna practice this again. Right? So,
I forgot to close one of the pens and it's empty.
there's always gonna be an upper pole, which is superior, and there's always gonna be a lower pole, which is inferior. So that's not the kidney. Yeah, just the kidney. I know. Gosh, could they just stick to one terminology, right? So not to confuse you, but in the real world, this is sometimes how it's gonna read. While you guys are in class, you can say superior. You're still learning that. I just want you to know, in the real world, you may hear this, you may hear this. All right. So let's take a look at it. This is a beautiful picture. Here is your beautiful cortex here. Love it. And then the medulla is this area. And then these things are the pyramids. And then your little minor calyces and your major calyces. Renal sinus. The hilum's going to be here. And then, of course, the ureter here. Don't let this picture trick you. This is still going to be posterior, this is going to be anterior. Yes, so medulla area is actually from here to here. And then it goes, if you drew a line, okay,
So that's including the pyramids.
it's
Well,
including,
surrounding.
yeah, and the surrounding tissue.
Sorry,
The
Toni.
column number
Yep.
2.
The left side is the upper pole.
The what?
The left side of this image is the upper pole, and then the veins.
It's gonna be different because if you're on the right side, the upper pole is gonna be in a different position than if you're on the left side.
Just the superior.
Yeah, walk you through that. Bree, did that make sense though?
Yeah.
All right, so this whole entire section here from here to here. This whole section. That's why I wanted you guys to color code it so that you would know It includes the pyramids, that whole entire section.
There's a reason
There's a big reason, because the echogenicities are different, and you don't want to mistakenly call a pyramid a cyst, and then try to give them 8 to 18 cysts. Right? And in the real world, we only measure 3. Please, we don't measure all. We do the 3 largest cysts in any body, like organ. And do not be that new tech that goes and measures everything, including the thyroid. We do 3 on each side, and that's it. Because no one wants to sit there counting cysts. And 3, imagine the person that comes after you. If you did 8 of them, they have to not only find all 8, they have to number them exactly the way you numbered them, and they could look a little bit different a year later, right?
So then, if you're doing like polyps and like something a different sonographer did, if they did like 10,
That's what you have to do.
do 10.
You have to do all 10. Yeah, doesn't that suck? It's only new techs who do that, by the way, so. That's not gonna be you, right?
Right.
So, the echo texture is gonna be different. So this is your renal pelvis, right here. This is where, if there is a backup of fluid, then, which we call hydronephrosis. Did you guys cover that patho yet? Yeah. It's gonna all build up in the calluses in the renal pelvis. That's where you're gonna see it, okay? And that's why it's important to know the echo texture and what it should look like. Then we've got the medulla. The pyramids are anechoic for the most part. They're not cysts. That's why it's important that you guys know that they are anechoic.
But then if there's a
And this,
cyst, how would we know it's a cyst?
sometimes you'll know, sometimes it's obvious, and sometimes it's not, you know. But you need to see it in 2 planes always. You cannot call it a pathology, which a cyst falls under pathology. You cannot call it unless you see it in 2 different planes. And I guarantee, if you look at it in a different plane, in transverse versus sag, you'll realize that it's a pyramid. But it's not always that obvious. It's not black and white with ultrasound. It's oh my god, I didn't have that, I promise. I promise. That just came out. Oh, and then here's your cortex, right? Alright. Again, so I did find an image that had the gyrandus fascia. So you can see the fat, we cannot see an adrenal gland though. And if this is the superior pole, and this is the inferior pole, so superior, inferior, if we could see the adrenal gland, where would it be?
Upper pole.
Superior. It would be right here. So guess what? You're just not going to see it. And that's a good sign. You don't want to see it. We don't want you to see it. So here's the renal pelvis. The medulla, with the pyramids, and then the cortex. There's a lot of things that you're going to look for in a kidney. And in kidneys, you have to be extra careful because usually if they have what we call RCC, which is renal cell carcinoma, they're going to be isoechoic. So they're very, very hard to see and find. But man, it's a rapid cancer. So you as an ultrasound tech, it is your responsibility to make sure that you are really looking in between the pyramids and you're really looking at that cortex. The other reasons why we look at the cortex is if it's too thin. We'll start off, for the most part, with a beautiful thick cortex. If it's under 1 centimeter, that means it has atrophy. So they are in some form of chronic kidney disease. So, and that is the cortex. Here. A lot of people measure the cortex and the medulla from here to here. And I'll show you some images. And so on the worksheets, they will ask you about cortex. And if you're gonna say, is it thin? Is it within normal limits? One or the other. They don't have us actually measure this unless we think it's too thin. And after a while, after scanning, you'll know. And so you can practice if you want measuring it. And, but don't give somebody kidney disease, because look how thin it is here, and that's just because of the angle. That's just angle dependent. So you want to find the thickest place. They used to have us measure here, and measure here. So you get 3 solid measurements. They don't have to do that anymore. They're making our life easier. They just want to know if we thought it was thin or not, and if we thought it was thin, we better measure it. And that would be under 1 centimeter. Make sure you write that down.
Toni?
Yeah.
It's really hard for me to distinguish if I would be including the medulla in my measurement.
Or distinguish what?
Like if you're trying to measure the cortex for the 1 centimeter, it looks like it's really hard to distinguish
Yeah.
where would you stop and where would you say the medulla starts.
Honestly, everybody measures it a little bit differently, but all I've ever really seen is they measure it from here to here. So they go.
Oh, they do go into the medulla? Okay.
Just don't do it where a pyramid is, then that wouldn't be accurate, because they're really looking at the tissue. But yeah, you would actually cover the cortex and the medulla.
Okay.
That's how I've seen it. And I actually did my internship, my clinical internship at a place where they still measure, and that's where everybody measured.
Is it inside
Okay.
to inside?
I'm sorry, what?
Inside to inside?
Well, it would be outer to in here. Outer to outer to outer. However you want to view it. But that's why echo texture is important to get great, is because we need to know where to measure.
That's just for the cortex. So it's actually
Yeah,
the
they just want
cortex.
to know how thick it is outside of the renal sinus. So kind of includes
So if it was like
off the close. I would still say within normal limits, but then I would put the measurement
but it should be 1 or under?
under 1. That's when it is thin, it's atrophied. You'll notice too, it'll become echogenic. Yeah.
So it will only measure under 1 centimeter when it's starting to shrink.
Yeah. So the tissue is starting to act. Yeah.
So normal is,
Anything over 1.
oh,
So anything over 1 within normal limits. And by the way, within normal limits, nobody told me this, is W and L. Hey, I didn't work in the health field. Nobody told me. So I figured that out on my own, so just help them know, so you may not have caught that. Okay, here's your measurements. See how they kind of are, they're just going into that section there. So the cortex should be hypoechoic to the other structures in the kidney, okay? The medulla and the pyramids are going to be anechoic. There's a pyramid. And then the sinus is going to be hyperechoic. Because there's a lot of fat and things in there. Now, if you see something that's super bright like a bone, what do you think that is?
Stone.
Calcification and a stone. And a lot of times you'll see that it's shadows. So we will measure up to 3 stones when we see them. We also put color on them. You guys probably haven't learned this yet, I'm assuming, but the twinkle sign. But when you put color on a stone, it's going to twinkle with different colors. So you're going to get the red, and you're going to get the blue, you're going to get yellow, you're going to get white, and it's just going to be like this weird little twinkle. And that's how we prove that it's a stone and not a fat.
why do
But why do we even have that flare if it's calcified?
I don't understand.
Like, are you thinking of
Oh.
because we're putting color on
The
it?
twinkle sign, oh, the color, it's not vascular.
What is it?
The twinkle sign is just artifact. Yes, there's a little interference, so it'll look pretty cool. And, but that's how you determine, because it could be fat, but if it's not shadowing, then I wouldn't really call it stone. Yeah, because the kidney also creates fat. And you can have, I think you guys have Paco already, right?
Not yet.
Not for the kidney? Okay. So there is something that we can get, and there's this little round mass, and it's got vessels in it, it's got fat in it, and so they're not nice to know that it's that and not like cancer, right? So you guys will learn the difference between the two. So super important, you guys will be tested over and over in all of your classes. I think it's even on your you're just gonna be asked cortex, hypoechoic, medulla pyramids, anechoic, and the sinus.
And that's only in relation to what it,
Only in relation
yeah.
to itself.
Yeah, I get confused
Yeah.
about that.
Yeah,
When
this
we're talking
time,
like
this one's
liver.
only in relation to itself.
Okay.
So the hyperechoic part's gonna be your fatty center. Obviously, the anechoic are the pyramids filled with fluid, and then your cortex and your medulla outside of the pyramids. Are the hypoechoic.
That's the measurement for cortex area.
Yeah, and this is the measurement, by the way. If you were to measure it. And this is how we measure superior to inferior, the longest length. And see how this one's labeled upper pole, lower pole? Because a lot of times when you find a stone, you're going to say, in the upper pole versus inferior. Again, not wrong. It's just a preference. Any questions just about this information? I know I'm giving you guys a lot of information because this is kind of new to you. You haven't had Ray's class, you haven't had your pathology. I knew this going into it, so I added stuff to help you, just a layer. And normally I wouldn't go into this much depth, but I want you guys to understand the concept. And then you'll hear it again in Ray's class, and you'll hear it again in pathology, and then it clicks.
If you hold this upper and lower pole, then what would be that one? That one? Like,
So
that
a
one
transverse, superior or upper pole. So you're always going to say superior, inferior on your annotation on your picture. But on the worksheet, a lot of times the worksheet will say upper pole.
No, I mean this part, then what are these two?
What's here?
Yeah. If something was there, what would
Oh,
medial? What?
yes. So it really depends. Are you mid? Are you medial? Where are you? And then this is where I was saying we're going to do some exercises at the end of class because it gets tricky. And you are on page 10. I'm almost there. I'm like on page 8.
I'm on the same page as you.
I know. What I'm saying is we'll get there.
Okay.
You're on mental page 10. We're still stuck on 8. Okay, so here's what it looks transverse. Okay, this is transverse, mid. How do I know that it's mid? Anybody, I mean, this is a wild guess. You may not know, and that's okay. What?
You mean transverse?
Yeah, because you've got, this is actually a vessel right here. This is one of the main vessels. And that's how you know you're at mid. Mid and medial will have the vessels. We'll talk about that again on that page when we get there. But I just wanted to show you guys what it looks like. Can you see that this is a pyramid here?
Mm-hmm.
This is a pyramid. This is a pyramid. This is fluid because it's blood. And see how echogenic or hyperechoic the sinus is compared to the hypoechoic cortex. Oh, and it's so beautiful when you put color on it, you guys. This is your Christmas tree. Isn't that awesome looking? Oh my gosh. Now, not all patients are going to look this good. You guys will when you're scanning each other. But sometimes you guys have really big patients, 400, 500-pound patients that you're going to be scanning. And to penetrate and get color that far, it's just not going to happen. There are ways that you can tweak your machine by decreasing your scale, your color scale, increasing your gain. Of course, this is all physics stuff. And sometimes they have a color penetration button. I know the IU-22 does. And you can hit that little penetration button, and sometimes it still won't help. So sometimes you just have to use physics, and even if you've tried all your tricks, it's still not going to light up. So you just want to get some color. You want to show that the vessel is penetrating and going in, and it's going all the way out here to what we call the arcuate. I didn't add the vessels for this lecture because I don't really need to. You're going to learn that in Rain's class. But if you need some help with it, let me know. Our next lecture. I got some good stuff because it freaked me out and I didn't understand it. And so I already have pictures prepared for you guys. I took them out though. I didn't want to overwhelm you yet. But I can add them to the next lecture. Okay, so kidneys. What are we looking for? You haven't had pathology yet, but let's talk about the things that we will need to be looking for. One is the echogenicity of the cortex and the sinus. Why the cortex? Anybody wild guess? Cortex. Why is that going to be important? What? Size, that's one. Definitely. Echogenicity, because if it's a trophy or they're in chronic kidney failure, then it's going to be a little echogenic. It is not going to be the beautiful, hypoechoic color. It is going to be bright. And you're going to be like, what? Because it's going to look like the sinus. Sometimes it's so shriveled and atrophied that you can't see anything. And you're like, where is this kidney? So that will happen. Now the sinus, let's talk about the sinus really quick. This is going to help you with your patho class going through this. The sinus should always be hyperechoic, but it shouldn't be echogenic, like calcifying. Because there is pathology you're going to learn about where that whole entire renal sinus can actually calcify and turn rough like a stone. Yeah. And of course, that's not going to help anybody filter anything out of their body, right? And so that's a medical emergency. And you guys will learn what that is. The contour. There's a lot of different normal variants that you guys want to learn in Rain's class. It's a long, long list. And I think when I was a student, this was my project that I chose to do, and it was talking about all the different variants. So you guys are going to learn the variants. Here's a few. I just put a few of them up here, but dromedary hump. Don't mistake that for a mass. Sometimes people just have a hump right here. And hypertrophy column of Burton. These are actually these little columns between. Let me go to this picture. This right here is called a column of Burton. And sometimes people are born with one that's just large. And so you don't want to confuse that again with a mass. Again, all things you're going to learn in Rain's class, but I wanted to give you guys a little bit of information. Sometimes they're born with lobulations here. It's called fetal lobulation. That's normal, so don't think that those are cysts or that they have like a bunch of stuff on it. So it's funny, breathe. You ask the number one question is, why do we need to know the ecotexture of the kidneys? And now you're realizing, wow, there's a lot. That's why. There's so much that you guys can get wrong, because there are a lot of different anomalies that you're gonna learn in Ray's class versus the pathology. And some of them look similar. So on your worksheet, if you don't know what it is and you're brand new and you're like, oh my God, I remember in class, Tony's saying, there's pathology and there's normal variant, I don't know which one this is. You're just gonna give differentials. Could be this versus this versus this. And again, you use the word possible, right? Possible, you know, dromedary hump, possible mass, possible whatever, right? And you're gonna do all the things. Get it in transverse and sag, 2 planes, put your color on it, and let the rad decide. And then make sure you get a good city. Always get good cities. So then there are some things called pancake kidney, where the kidneys, by the way, in a fetal, in a baby, when you're developing, the kidneys start down here, and then they slowly ascend. And not everybody's kidneys actually ascend, right? So this poor baby right here, they just kind of got stuck, so they're lower. So if you're searching for kidneys and you don't find any, start searching everywhere, because they also can have what we call a horseshoe kidney. And a horseshoe kidney is where they kind of separated, but they did it, and now it looks like a horseshoe. And that's all going to be found in the pelvic area. Yes. I mean, I would say there aren't, but there could be complications based on how it's fused or how it didn't fuse, right? So there could be complications. But I would say most of the patients I've seen who have like these kinds of kidneys, they're just fine. And you can function on one kidney, you just can't function kidney, right? So if you only have one kidney, don't drink and don't take ibuprofen or anything like that, because you need to save that kidney. And eat low salt, right? Serve the one kidney you got. Kill young guys, you can kill off one if you need to, right? So there's a bunch more variants in this, you guys. I just put a few here for you, so you can study it before Rain's class. But the variants can be like one just didn't form, or 2 of them, they went like this, and then this one decided to skip over, jump ship, and be like, no, I missed you so much. And then they're like together, you know? And so you're gonna be like, you're gonna see like 2 little C's like this. You're gonna be like, what am I looking at? So this is what a cyst looks like, by the way, right here. See how different that is from a pyramid? Yeah. And so would that be superior or inferior pole? Superior. If this was the right. We'll check it later. Size obviously is important, as you guys know, size of that cortex and overall, because if it's sick, it's gonna do what? Shrink. Actively, you guys shrink a lot. Look, echogenic, I believe that's one of the questions on one of your homework. Pathology, there's mass, cyst, hydronephrosis. Here's hydro, by the way, what it looks like. We know that this should be echogenic here, or hyperechoic. And so there's different grades to how bad the fluid can get. And so these are just the different grades, and you'll learn about them. And on your worksheet, you'll end up having to say, is it mild, severe? You know, they'll give you a little rating. And eventually you'll figure out what is what as a 10. Any questions? I know this is all stuff that you haven't learned, but I wanted to bring this up now so that we could practice. Because if you were confused on the spleen, you're going to be confused on the kidneys. Yeah. Oh, and the liver was really easy. So if you're confused
upper pole, lower pole. I don't care what verbiage you use. For now, probably stick to superior and inferior because it's easier. So the protocol is to take a little cine. You like my little cinema here? Alright, so you're gonna label it right kidney sag, and then you're gonna go lateral to medial. So this is the most lateral aspect right here. And this is the most medial. And the medial aspect is where the hilum is, right? That is where you're gonna take color. So you're gonna take a cine, you're gonna see it, and you're gonna go all the way lateral, slowly and go medial, and then save. So now the doctor can see the whole entire scan of your kidney, and they can freeze it, they can blow it up, they can do all kinds of things. But you need a really good cine. So make sure you're optimizing your image and that it's not too dark up here and not too bright here. You don't want to give pathology. This is where your TGCs really play a role. Then what they want you to do is take a picture lateral, then mid, and then medial. And when you're at medial, that's where you're going to see vessels. That's also where you're going to see hydro. So you're going to put some color on that, and it's going to light up like a Christmas tree, and that's going to be your medial aspect. So if we go back, that's your medial. Then if there was hydro, these wouldn't fill very fast because you would have all the a bunch of anechoic spaces. So you will know. Okay, so then now we're going to go in transverse plane. So this is the most superior, inferior, and we're just going to chop it into 3 sections. So you've already looked for all the hairy scaries out here, right? Just like you did with the liver. And so then you're going to take a representative image. Before you do that, you're going to take your cine though. You're going to start superior, all the way out, by the way, all the way out. So you're going to see liver because you're very superior. And then you're going to slowly go all the way down inferior, and then boom, take your image. So superior, mid, when you hit mid, this is where you're going to take your color image. This is also where you're going to see if there's hydro. And if the hydro is really bad, sometimes you can see it in the upper or the lower pole. Yeah. And then you take your inferior picture. So you've got 2 cines and 6 images of the kidney that you're going to be taking. And remember, always scan the kidney first before you take any images and before you actually do your cine. Because you want to thoroughly look through it, right? And make sure that the pyramids are not cysts, make sure there's no stones. And those are all done last, but you've got to give yourself an idea of what you're working with. So you always have to scan through it first. Why do we do movie or like this recording for the kidneys, but why can't we do it for the liver too?
Good question. We always do it for kidneys, no matter what. Liver, if they have cirrhosis, or if you find something in the liver, then you do a cine of the liver. But if the liver is healthy, happy, there's no need to waste your time doing a cine. Yeah. But the doctors want to make sure that we get a cine of the kidneys and still images because they want to make sure he didn't miss anything. That's how important renal carcinoma is. Yeah.
Only if there's cirrhosis in the liver or just any pathology?
Usually cirrhosis is a 100%. If you got cirrhosis in that liver, you're doing both planes, left and right. Yeah. Lots of cines. Yes. When they're sick, you take a lot of cines. That way, if you miss something, they can freeze it, they can look at the cines. Yeah. And very important that you go back and look at your own cines. Make sure you didn't miss anything before you walk the patient out. So I always look at my cines because I've done that. I've let the patient go and I see something in the cine that I didn't see in my stills. And I'm like, great.
Oh, please come back. Come back, please.
Call the patient back.
You run right out to where the car is.
Look up, right? Yeah. Yeah.
But when you say hydro,
Yes.
the thing that was just floating
hydronephrosis is what it's called. So fluid in the kidney. Yeah, we call it hydronephrosis. Yes, that's a term you'll need to know. And but it's fluid in the kidney. That's not a good sign, because if the fluid's backed up in the kidney, then there's something going on between that and the bladder, right? So most likely they have an obstruction, or a stone, or they could have TCC, which is a type of cancer growing in that ureter, or in the bladder. So there's a lot of things that we have to look at. And anytime we do the kidneys, by the way, we always look at the bladder. So we'll be taking pictures of that. We're going to talk about that. All right. Let's talk about that, actually. Urinary system. So 2 ureters, right and left. They begin at the kidney hilum, travel inferior to the bladder, where they enter what we call the trigone on the posterior aspect. You will need to know that for Rain's class. Trigone, it's like 3 little areas, but the top 2 is where the ureters connect, and they're connecting into the posterior aspect of the bladder. Okay? In other ways, because we're all born a little different, you may see one that is connected off to the side. Bladder sits within the midline of the pelvis, and the urethra is a membranous tube that extends from the urinary bladder to the external opening. Here it is. So here's your trigone. The left is going to enter here, and you can kind of see how they drew the little lines. But the right connects here, and it's all done in the posterior aspect, and then goes down out to the urethra. So, and you can see this is very muscular, so it can expand and contract. You guys learn all cool things about this. Sonographic appearance, here you go again. For those of you who need to like wrap your head around like this 3D stuff, I found some pictures. I thought this would help. So basically you're just slicing that bladder. So this is a sag bladder, and this is what a sag bladder is going to look like. Kind of a little lopsided bladder. But here's what it looks like in transverse. See that beautiful transverse? Should usually try to always get it to look like this, because you'll know you're on it correctly when it looks like a square. You are not going to see the ureters when you guys are scanning these patients unless there's an obstruction, and then you will see this random thing off to the side, usually down here, over here, up here, it could be anywhere. But because they come in posteriorly, a lot of times you're going to see them around this area. And they will be anechoic, and you'll put color on just to make sure it's not a vessel. If it lights up, it's a vessel. If it doesn't, it's a ureter. And that's not a good sign. And now you got to like scan it, try to find where the problem is. So this is your transverse, this is your sag, and you guys will learn how to measure it, get the volume, not a big deal. If it's fully distended, it's, yeah, we already talked about that. Alright, sure. Oh, colors! Oh, I love it! I don't know why I get excited, you guys, but I love color. So I took a lot of different examples here. Most of the time, their ureters are going to look like this. When you put color on it, this one is coming from this side, which if I cut this in half, is that the left or the right ureter?
Left.
It is the left, especially because it's aiming this way, right? Because they're coming in posterior, and then it's going to shoot out. So it's going to go this way, this way. They're going to cross most of the time. And so this is going to be your left. And as you can see here, you can get the left and the right at the same time. Sometimes, and here again, left and right. This is the left coming out from here. This is the right. So we can't see where it's coming out, but it's coming out right around here, and this one's coming out right around here. Now, if we know they're coming out in the posterior aspect, where should our probe be if we're in transverse? Should we be superior, mid, or inferior?
Inferior?
Inferior, because that's the most posterior aspect, right? So you're gonna shoot down like this, and you're gonna look for the trigon. There's gonna be a little lump like this, and that's how you're gonna get it. And then you young, beautiful bodies are gonna look like this. In fact, if I look at this picture closely, I'm seeing two. This person might have a duplicate ureter, which happens often. So I'm seeing two left ureters. But I don't know, because I'm not live. I have to go live to know that.
Can you explain again? You said the ureter don't have color before,
The ureters, yeah, they won't have color.
but then what it is?
But because these are shooting in, right? With physics, color either it's coming towards the probe or it's going away from the probe. Ureters are not coming towards the probe at all because they're going this way. Now, if I angled it towards the ureter like this, then I would probably get some kind of flow. But we're on top of it. We want to be on top of it, so we don't get any color. But we will get color because it's shooting out towards us. Because it's coming from the posterior and shooting towards my probe. And that's why we get color. Because it's movement. It's not necessarily are you an artery or vein, right? It's all about the movement. And since it's coming towards the probe, most of the time it's going to be red.
So it's urine.
And it's
But
urine.
then
It's
how
just
would-
urine go.
But then how would I know if it's urine or vessel?
There's no vessels inside the bladder, so you're going to know it's urine.
And everything next to it if it has color.
Yeah. If it's a vessel, but you can see like there's a vessel right here picking up. Usually the vessels are going to be down here. But there's no vessels inside your bladder. Yes, dear?
Why is that the left and not the right?
Remember, if I'm transverse midline, breathe, we're midline.
So is that transverse or sagittal?
Transverse.
We're transverse.
Oh.
You only get these in transverse.
Oh, okay.
Okay? You only get them in transverse, otherwise you won't really get them. Yeah. But we're midline. So we know, if we're midline, we know that this is right, we know that this is left. And since this is going this way, we know it's left. If it was going this way, then we know it's coming from the right and pushing out.
And you only get the pictures of midline transverse.
Yes. So we are midline in the pelvic area, transverse. Yes, dear.
So, will we only see the ureter right up the color
You're not going to see the ureter at all. Because the ureter ends when it hits the bladder.
So is this, she was talking about
Jet.
jets?
These are jets.
Those are the jets.
These are the jets.
Okay.
We call this the left jet. This is the left jet. And this is the right jet. Don't worry, because you're going to use the terminology jet. I wasn't sure if you guys learned it yet, so thank you. You'll use that, and your clients, your patients are going to be like, what are you talking? What's a jet? What's a jet? You see a jet? What's a jet? And you're like, oh, it's just urine.
Like a jet.
Yes. But doesn't it look? It's just like, and sometimes it's gonna go, and it's pretty cool. So when you guys get to practice scanning, yeah, drink a bunch of water. It takes 40 minutes for water to go through the body, so don't expect yourself to drink water and then all of a sudden see jets. Yeah. And any other questions? We know that this is that anterior, posterior. So we're good. Right, left. All right. Bladder. What kinds of things are we looking for in the bladder? Stones. What else? Bladder cancer, TCC, SCC.
Will you get polyps?
We get
No, I don't think so. I mean, black and white hair, I'm not gonna say no, but I've never heard of it or seen it. But what we do get is sludge balls. This is what we call sludge ball. Now, if it was connected to the tissue here, that would concern me cancer. Because cancer in the bladder will protrude out look just like that. So you want to see, does this move? So what are you going to do? How are you going to know if it moves? Roll that patient. Got it. Roll up. Right. Okay. Roll. All right. And here's your stones. We got the shadowing, so we know they're stones. And this is some low-level echo and debris. So this person most likely has a bladder infection. Low-level echo and debris means some kind of itis. And so they've got some debris here. Whoa, what is this?
Septum? No?
This is like two bladders. They don't have two bladders. What they have is what we call a diverticulum. And that is just an outpouching of their bladder where excess fluid runs into. So for those patients who pee and then they have to pee again like 5 or 10 minutes later and they come in and are, I don't know, I've had this my whole life. I pee and then I have to pee again and it's silly. I feel like I'm always having to pee. It's because the first time they pee, they let all this out. But then this stuff drains in here and then a few minutes later, they gotta pee again. So it's your job to really scan and make sure, do they have something like that? Yes. Sometimes yes.
What was the question?
And sometimes they give antibiotics. Sometimes it depends on what it's diagnosed with. So they're going to do a urine sample analysis, and that's going to tell them what it is. And then based on that, they're going to either choose to drain it themselves or just give medication. Yeah.
What was the question? We couldn't hear.
Oh, yes. The question was, how do you get the sludge ball out?
How do you pee sludge?
Do you pee it out? What happens? Yeah. So if you guys, because we've got a lot of women here, if you've ever had a UTI, this is most likely what your bladder looks like. It's got some low-level debris in there. Why? Because there's an infection. Yeah.
I was thinking about the
Yeah.
Can the diverticulum?
And you never know, it could look like a sludge ball if you let it get so bad. And if you don't take care of it, guess what happens?
Stone.
It goes up, it ascends to those kidneys, and then, die. Well, I mean, if you didn't take care of it, I guess, eventually. But you'll be in so much blank pain. You're gonna be like, what's wrong with me? You're gonna go into the doctors. They're gonna throw you in a CT most likely after they already did an ultrasound, and then they're gonna tell you have an infection in your kidneys and your bladder. Not good. But and it has nothing to do with you being a good or a bad person, you guys. If you have a stone that comes through, it's gonna rip and tear all that skin, and guess what it causes? An infection. So there are a lot of reasons why you can get infections, but you do definitely have to take care of infection in the kidney and the bladder in a decent amount of time. Yeah.
But this one would be asymptomatic, right? So it's just a sludge?
Not necessarily, because it might hurt to pee, right? They might feel like they have to pee all the time. So there can be different things associated with it. Yeah. So we're looking at the echogenicity. Is it anechoic fluid or are there echogenic debris, low-level echoes in there? Yes?
The sludge in the bladder, is that urine stasis?
Is that what?
Urine stasis?
It could be.
Yeah. Okay.
Yeah.
Or an
Yeah.
infection?
Or an infection. Yeah, if urine can't go out, that's a really good point, Connor. If urine cannot get out of that urethra because maybe there's a stone stuck and it can't get out, then it's just sitting in that bladder. And if it sits in that bladder, it's just gonna get gross. I mean, think about it, right?
Oh, too big prostata sometimes. Yep.
Yeah.
In the diverticulum,
Sorry. Poor
will it
man.
go away, or is this something?
It's a permanent, like, you've got a permanent issue there. And some people live with it, and some people prefer to have a surgery.
And I was wondering, does the urine empty out of the diverticulum first, or
soon as this is empty, with physics, you guys will learn. Like one thing empty is this is full. It's just gonna drain,
So
right?
it drains into the diverticulum.
It's gonna it's when the bladder fills up, it also fills the diverticulum. But when the bladder is empty, the diverticulum, the fluid in there, will drain into the bladder and get small. Does that make sense?
Toni, have you ever met inner body in the bladder? Inner body.
What?
Inner body. Some people do like to put inner bodies in their bladders. Have you ever met this in your practice?
What is that?
It means some kind of wires or toothbrush.
Catheter?
Yeah.
Oh, a catheter. Oh yeah, they will use a catheter sometimes to drain these.
I think she's saying it's like
drained.
I think she's saying like if somebody
I mean, this could also
It's
be
okay.
a hematoma, you guys.
Maybe she didn't meet. I'm
This
just
could be a
curious.
lot of
It's-
things. That's why
Sorry?
we don't have to diagnose it.
No. When people put through their ureter, they put inner bodies like wire, toothbrushes, and so on and so on.
Yeah.
And it's stuck in the bladder, and you can find something. Ta-da!
like a toothbrush or something, like a foreign.
Oh, in the urethra?
Yes.
No. I've only seen it in the anus. And they do have some wild stories.
Probably the
And when you
feet.
work in the ER, you're gonna be like, oh, so you're
But the
running
urethra's
around in
not-
your garden naked and you fell on the cucumber. Okay.
It's interesting to hear what it's like internationally.
Uh-huh. Because of my criminal stories, you can
I mean, these are
find
only
it.
experiences I've had, so I'm working for the
Whichever.
yeah, but not in the urethra. No. I would hope not. So the size, we gotta know: is the size, is it over distended? Is it decompressed? Is there still post-void residual? When you're scanning a patient and looking at the bladder, you're gonna take images of the bladder. You're gonna measure the volume. Then they're gonna go pee, and then you're gonna measure the volume again. We call that a post-void volume. And you'll learn in your other class, it's not good if it's over 20 milliliters that they still get out. The bladder wall, the thickness, right? Is there any finger-like projections coming out of the bladder wall? And then of course pathology, masses, stones, all that kind of stuff. So the bladder, we're looking for a lot of different things. It seems overwhelming, but once you put your probe down and you look at it, as long as you know what normal is, you guys, you'll know what not normal is. That's all you need to do. Know what normal is. And then you will know what not normal is. And when you're beginning, ask your tech friends that you work with.
Foreign body.
In your clinical site. I don't know what this is, but I know it's not normal. That is okay to say. Alright? When you're learning. And then jets. You gotta make sure the jets are working. Why do we check the jets? Obstruction. Right? Yeah. Alright, the bladder. This is how we scan it. We take a city of the bladder, just in case we miss something. So you're gonna go in Sag is right to left. Right? Because we're in midline. And then you're gonna take your images, right, mid, and left. That is gonna be in Sag. In transverse, you're gonna go superior to inferior, then superior, mid, inferior, come back, and that's where you're gonna put your color on. Your color's gonna go on mid. Or sometimes inferior, depending. Yeah.
Why can't we put color right away? Why does it have to come back?
I always like to get my images first, and then, because sometimes it takes a while for color for the ureters to work. They become really shy when they get scanned. And so you want to make sure that you can sit there for 5 whole minutes, and that's what you have to do. If you can't get ureters, you need to prove. I always take a picture when I start, and if I can't get anything, you wait 5 minutes, and you will be adjusting your color. You'll be closing your sector width on your color box. You'll do all kinds of things. You'll have them turn their head and like cough, and still sometimes nothing. keep them in a supine position the whole time. But you can have them turn their head to the right or the left, give you a cough, and then whatever side you had them turn to is where the jet will actually, yeah, it's weird. It happens sometimes. Now, if they did say there is, again, nothing black and white, right, with ultrasound. So if they're like, oh my God, I'm gonna pee, I'm literally programming, I'm gonna pee. And I'm like, okay. Then I get my jets first. That's the only time I get my jets first, because they're probably still working to fill up the bladder, and they're gonna pee, and I need to know that those work. That's the most important thing. And then I'm gonna boom, and take my images as fast as I can, and then I will calculate them when they're going to pee. If they don't have a full bladder, then I start with the kidneys instead of the bladder, because it takes 40 minutes, and it'll take you guys probably 20 minutes to get both kidneys. And then by that time, the bladder will fill. And if not, you're just gonna write, patient did not follow instructions, bladder was. Not much you can do.
And then send them back to the front and we'll reschedule.
Yeah. If they don't have a full bladder, is it like a size thing, or is it just not most likely they didn't drink their water like they were told to. They're really bad patients. It'll just be really small. So it's a size. Yeah, it's a size. Yeah. Just like with a postvoid, you can still find it. It's just gonna be like this tiny little thing. Sometimes you can't even find it. And you're like, postvoid, completely. Always a good sign. Yeah. Good questions.
Could you take your images from your
What?
Could you take your images from your video?
Oh, no, you can't. Not unless you do it right then and there. Because you can take your cine, and what they don't want you to take a cine and then get your images. I mean, I would say in a pinch and a vine, but yeah, I would try not to do that. Because they're gonna show movement and you won't have a clear image. Oh, you guys, let's practice. This is the hard part of today. All right. So, I kind of drew kidneys for you already. I mean, this is the best I could do with what I had to work with, okay? So the kidneys in transverse are always gonna look like a C, okay? And the kidneys in sag, as you can see, are gonna look like a half a pizza. All right. So, the first one, let's do this one together as a team. There's a mass located that let's draw.
Two Boston.
Okay, what kidney are we on? Are we on the right kidney? Yes. Okay. So I'm gonna label it right kidney, transverse, right kidney, sag. Okay, so when we're scanning typical patient, let's say we're gonna be right here and we're transverse, so we're not coronal. So where are we touching? Anterior. So then we know this is posterior. What's this gonna be? Right lateral. What's this gonna be? And I already know that it's gonna look like this. That's my way of drawing. So there's mass located on the lateral aspect, so we're lateral, somewhere here, of the mid-right kidney. So that means this thing has to say right kidney, transverse, mid. Because if we're either superior, mid, or inferior. mid-lateral, and it's a mass. So I'm just gonna draw it there. Does that look right to you guys? Alright. You're like, sure, yeah. Do we need to slow down? Okay, so we are anterior, posterior, lateral, medial. So in Sag, now we're going Sag, alright? And this is the lateral aspect. So in Sag, remember there are 3 pictures. We take lateral, mid, medial. Right? Maybe I should turn it to this page for you guys. Just a reminder. Really quick.
Excuse me.
Lateral, mid, and medial. But this is saying we are in the mid right kidney. So we're going to say right kidney, sag, mid. Okay, where are we touching? Are we still anterior?
Yes.
Yep, we're still anterior. So we've got anterior, posterior. Now where? Superior, inferior. Lateral aspect of the mid-right kidney. Well, where do we draw this? We're in the mid.
Wait, Tony, I thought lateral and medial is just for the first section.
For what?
Or just for the first section. Lateral medial?
Yeah.
Lateral medial.
And
No,
then
you're talking about how are we gonna do lateral medial first
We can.
It should.
Yeah. That's the trick. Connor?
Wouldn't we show the sagittal lateral image? Wouldn't that be the image that would display the pathology?
There we go. So the trick here, even though it says mid-right kidney, we are not going to see anything unless it is lateral. I had to confuse you to make you understand. Because it's lateral, mid, medial, and the only way in Sag to get that lateral aspect would be to use the lateral image. Connor, way to go.
Wait, excuse me.
And so, do we know if did they say it was superior or inferior? No, so I guess we're just gonna put it right here. Or, even better, we could just do this.
I'm sorry.
Yeah, so. Which part?
Everything.
Everything?
Lateral.
Okay,
Why is the lateral not mid? Yeah.
let's do this. This is our first image, right? Lateral. This is gonna be our mid. Don't worry, I expect you to be confused. This is why I did this for you. Right here. So the 3 images you're gonna take. So the top one is gonna be the lateral, a slice of the lateral. And then the mid is gonna be just a slice of the mid. And then you take a slice of the medial. Even though it says, it was in the mid, we know that it's in the lateral aspect is where the mass is. And so we have to show the representation of the lateral. Does that make any sense?
Tony,
Yeah.
quick question for you. Why do they bother putting 2 questions in one? Why don't they just ask it in 2 different questions? One for Sag, one for transverse. To me, I mean, do they really do that in the real world, or is this just like?
Yeah, because you've got to do it in 2 planes. Everything has to be found in 2 planes.
No, I mean, we understand that, but why do they ask it
Oh,
like this?
Just being tricky. And you know what? I stole these questions I took from Leah. I'm probably gonna change them because like
It doesn't make
it's
sense.
confusing.
And why ask it? Yeah.
But Shay's gonna give you these confusing questions, and that's why I want you guys to think outside of the box.
I think, yeah, just to get you thinking about it, not necessarily.
But it's like you're making it up. It's like lateral but not lateral. Oh, but mid but
Just
not
practice
mid.
with your
It's like what?
with us. Yeah. And scanning live is gonna be the best solution. Because when you scan it, you guys will understand it better. So for this question, it is confusing, but the lateral aspect of the mid-right kidney. So technically, there's 2 things we can do here. We can either show the lateral image, but it didn't tell us if it is superior, inferior, or posterior, or anterior. So if we're giving a mid image, it's not going to be in the mid image, is it? It's only going to be in the lateral image. And so this kind of is a little confusing.
So you wouldn't draw anything?
So if you drew it, technically you're not going to find it in the mid, so you're going to have to draw the lateral.
But then you drew for the side.
And this is going to be the lateral aspect.
Yeah, but because you have the question.
Yeah, it's just the question that's confusing you
It's
guys.
saying lateral and it's saying.
Yeah. Yeah.
Yeah.
So,
I mean, she took the mid section.
so this is gonna be where we cut things off. Okay? So this is the lateral aspect. This is the mid,
Oh, yeah.
and this is the medial. Right? We're gonna start coming in now. And I bet you anything, this is where it's gonna be. Because they said lateral. They didn't say anything else. They didn't say superior. They didn't say inferior. They didn't say anything. So the most lateral will have it. That means the mid, you're not going to see anything. So here in the mid, there's going to be nothing in the mid. But in the lateral aspect, which lateral looks a little bit like this. It's not as curvy. It's going to be somewhere around here. Especially because we drew the borders close to the border here on the lateral.
So if they had said that
Yeah.
they were in the medial aspect of the right kidney, you would draw the medial. Okay.
Yeah. Yeah. So it's there to confuse you, and I'm sorry. I should have drew it out myself. I was just like, Leah made us do it. We'll figure it out. So, okay. So this is going to be tricky again, because now you've got a medial aspect and an inferior portion of the right kidney. So let's erase everything. And let's do another one together. And I'm going to help you guys a minute. Just a little more. So this is transverse, right? Always looks like a little C. This is sad. So in transverse, it's always going to be superior. Then you've got your inferior. And your mid. Okay? So that's how we're going to slice them here. So hopefully these images together will help. So,
Wait, what? For transverse, superior, and inferior?
transverse, we're always cutting it superior, inferior, or superior, mid, inferior.
Is that supposed to be anterior, posterior, right and left? For the transverse?
Superior, mid, inferior.
Oh,
even though you're anterior on the body, that's okay. We all have.
You're talking about specifically about.
I'm talking specifically about the organ. You just need to stand up. Get a little blood flow. Let's stand up and get a little blood flow real quick. It's hot in here today.
It's cold. Just for you. Yeah, it's cold.
It's cold. My nose is like frozen.
Yeah, my feet are frozen.
I know this can be confusing, that's why I saved it to the end. And you guys will get a head start on this, but you're going to learn more in like lab and pathology. You'll learn more in Ray's class as well, so we'll later. I always seem to be the first one to teach you guys. And I'm like, no! Sorry.
I would rather start with you, it's better.
Like this next quarter. This is the first time, by the way, your teachers are all getting together for the first time today at 5. And we're doing it via Zoom. So that this no longer happens. So
Yay!
yeah, I had a little chit chat. I was like, I can't do it. I need us on the same page. So we're gonna be behind in some classes, but next quarter we will be working together. All right, shake it out, get some blood flow, and sit back down. All right, this time, outside of Tommy and Connor, who wants to volunteer to come up? Be brave, it's okay. I'm here for your safety and your security. And if you get it wrong, I'm here to make sure you don't get it wrong. Do not make me think you.
I'll come.
Okay. All
Y'all
right.
can correct me, help me.
All right. We're going to do number 2 together. So there's a mass located, where are we at? Right kidney. So let's put right kidney. And then transverse and then right kidney sag. So everybody do that. This is number 2. Oh, we'll get there. Yeah, we'll get there. Maybe not. Right kidney sag. Yeah, number 2. Okay. So we're going to dissect this slowly. Okay. So there's a mass located on the medial aspect. So let's draw our, where are we at? Everybody help her out. So in transverse, we're on the right kidney. So anterior posterior, right lateral, right medial. And in sag, where are we? Anterior posterior. She's like, I'm superior, inferior. All right. Is that correct?
Yes.
All right. Do you guys care? Yeah. Okay. Just making sure. All right. She's drawing the C. Good. She's gonna draw her other guy. All right. So, because this is the medial aspect and the inferior, so transverse is going to be inferior. So it's going to be labeled inferior. So it'll be right kidney transverse inferior at the top.
Yeah, so I was thinking inferior because.
Yeah, because it says, right? It says located in the medial aspect of the inferior portion.
Because it doesn't have an inferior, I would say. Yeah, I'm trying to understand the process why you chose
So, and we're going to redraw these because we know we have to be inferior. And we're not going to get the C. We're not going to get the C shape because the C shape is really when you're mid, right? When you're superior, yeah. In fact, I can draw it really quick. It's going to look like this. Superior is going to look like this. Mid's going to look like this. And inferior is going to look like this. Transverse superior and inferior. Yeah, perfect. When you are in sagittal, those laterals gonna do this. Another guard, hold on.
Just gets bigger and smaller, yeah.
Fantastic.
This one's trace tricky. And when you're medial, this is where you get the vessels coming in. Probably should have started with that, but now I know for the next class, next year. That's probably helpful. Good, you stay. You got this, you're doing good. So now we need the inferior drawing. Here we go, in the transverse. Okay. Perfect. And we need the medial aspect in the sag. Perfect. And then we need to label this inferior and label this what? Medial. All right. Now we just have to put the mass. We did all the hard work. Where is this mass located? Medial aspect, inferior portion, right? All right. Well, there's a medial aspect. There you go.
Yeah.
Whoa, this one's working out. Woohoo! Okay, and medial aspect, inferior portion. Where is that going to be? Is that an inferior? No medial. So we're going to go, boom. She did it. Yay! Thank you. You guys give her a hand. That was great.
Yeah, that was great.
That was great.
Good job, Sharon.
Oh my gosh. That's a lot, right?
Participation, Tony, I'm getting 5, right?
Yeah, for
Whoop, whoop.
sure.
All right.
Sure. You get a hundo. Some extra credit. All right. So let's do the next one together, but without me drawing it on the board. We're going to talk this out. So what's the very first thing we need to do? Label it. So let's label right kidney transverse, right kidney sag.
Left
Number
Left.
3. Oh, sorry. Left kidney. Oh.
Tony, do we see left kidney in transverse opposite direction?
Never mind. I have to help you guys. We're on the left kidney now. Okay. Okay. So left kidney, okay. Transverse. Left kidney. Sag. So now we have to figure out where we're at in the body. This is the left side. So we're still going to be here. We're not going to be coronal. I'm not going to scare you and make you do coronal. Sometimes though, we'll scan a kidney coronal, but we're going to be anterior. So in transverse, what is it? Anterior? Posterior. Yep, anterior, posterior. And then what do we got? Left. Left flat.
Wouldn't it be?
Yep. Yep. On top of that one.
Did you ever play those games when
Okay, how about sag?
where you make up the rules when you go along?
Are we touching anterior?
Yeah.
And posterior? What's this gonna be?
Still superior? Superior.
We're here. My notch is always going to be pointing at noon. So we would still be.
Superior.
Yeah. We got there. The only thing that's going to change is that transverse. Any questions about that? Oh, one thing stayed the same. That's right.
Why is the left side left medial and not left lateral?
Because we're on the different parts of the body.
We're here. So left lateral, it's gonna be here. On that side. The left medial is gonna be here. Because we're here. Remember if we were midline, right? It'd be right and left. When we move it over to the right, then it's gonna be right lateral, right medial. When we move it all the way to the left, we've got left medial now on this side and left laterals on the opposite.
I guess I don't understand why it's not the
Lateral there.
right there, yeah.
It's left lateral because otherwise you would be right laterals here, left laterals on this side. It's okay, your brain it'll connect. It'll connect.
Just think about where the notch is. The notch is towards the midline of the body.
Yes.
And the
Thank you. Yes. Your notch.
notch is right there.
So your notch is always going to be there, which is gonna match with there. And that's 9 o'clock, right? 9 o'clock. So medium. It'll connect. It will. I promise. Alright. Now that we got the hard part done, there's a mass located in the medial aspect of the mid left kidney. Okay. So we know that it's medial, and we know that it's mid. So mid, what is mid gonna look like? Your little C.
No. No.
No, opposite.
Again, sorry, hold on.
Gonna be a comma.
The other way around. The backward C.
Ta-da.
Remember, superior, mid, inferior. So they're saying it's mid left kidney. So we have to draw the mid left kidney, and that's a horrible scheme. Let me try to draw a better one.
So if it's the mid, wouldn't it be the circle then?
No, mid is going to be your C. That's where the vessels are coming in.
Those three images, do you see?
On the bottom, see that? Our little cheat sheet. And it switched because, yeah. This is the lateral aspect. Okay. You guys have to click now because you guys are going to have this in your other classes. I just thought we'd get a head start on it. Alright. Medial aspect. Okay. And the medial didn't say anterior or posterior, so she's tricking us for sure. So we've got vessels coming in here. So I'm assuming if it's close to the medial aspect, it's probably close to those vessels somewhere. And I think these are much harder than your homework would be. If I remember the So we know it's going to be left kidney transverse, mid, and then left kidney sag. So we need a medial aspect. So again, medial aspect. Those are my vessels, my
That's
dad.
a sag. That's the same. Wouldn't it be like upside down, like this middle part?
Correct.
Wouldn't it be upside down?
Probably correct. No, it wouldn't. No, it's always gonna look like that. I just have to think about it really quick. Yeah, no matter what you do, it's always gonna.
So that.
The C is the only one that's gonna.
The one on this side stays the same.
Because kidney sits like this, right? And here's your right. Here's your left. We'll practice a lot more, you guys. Am I confusing you? Okay.
Oh, that's cute. It's
Once
for
you
Becky.
scan it, it will
It's what?
make-
For Becky to understand right,
Okay, okay,
lateral, right, medial.
Yeah, sure.
Read, am I wrong?
Yeah, go get it.
Transverse, like the middle, the mid transverse was flipped if you're then on the left of it. I thought the sag would also be mirrored.
No, the transverse is the only thing that's gonna change on the kidneys because one is sitting at a C like this, the other one's sitting at a C. But it doesn't matter if we're doing lateral, mid, or medial in sag. Lateral, medial, mid, or mid, medial. It doesn't matter because it's still gonna slice the same, but it's gonna slice different in transverse. Does that make any sense? Nope. The mid, we're gonna slice it this way, okay? When we slice it that way, it's gonna look like this with vessels coming in. When we slice this one this way, it's gonna look like that. And so that's what it's gonna look like in your ultrasound images. Now, the confusing thing is when you are scanning, when you're scanning the right kidney, your lateral is gonna be here, right? So you're gonna go from this way to this way. When you're scanning the left, you're scanning this way to this way, not this way. So you're starting here, and you're starting here. So you're going different directions, so you're gonna get the same image in SAG, no matter what. So your SAG image for this medial aspect is mid left peak. That's still gonna look like.
I think it's just not time for us to train
It
this
isn't
skill
worse.
because people are tired just because we have an
Well, liver's is a big organ.
Or did we get to your like, this is the worst one, this is the worst.
Kidney, like always confuses me. The good thing is once you understand the concept, you stop thinking about it, and your hand just knows what to do. That's why when I actually have to break it down for you guys, I'm like, wait a minute, let me think about this, because I haven't had to think about it. The liver is straight. You just boom, 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 boom. Kidney's the same thing, except they're in a different shape. And so getting your head around that can be really confusing. Okay?
And will there's no medial aspect.
Exactly. So again, I'm gonna have to change these because otherwise, what we don't want to do is ruin your confidence in the beginning. Clearly, I will be using my own examples next time, and not what Leah had us do.
But keep your pictures because the whiteboard pictures, especially on the right side of the whiteboard, that's given me a key to unlock it. Yep.
Perfect. And I'm not the best at drawing.
It's okay, we just,
Do
it's
you guys, I know it's a large class, but do you guys want to see me scan someone's kidney real quick just so you can see it? Alright, let's do that. Somebody see a body.
I'm already late for my 3-hour bus. I have time for this. It's okay.
I want to be scanning myself. Oh.
And if you want, I could split you guys up into two so there's more room. I don't care. I'm good with whatever. Let me wash my